Another of the common eye disorders that Dr. Hertz mentioned at the start of the show was glaucoma. It's a bit more complex than cataracts, but ophthalmologist Dr. Hertz explains just what glaucoma is and why we get it.
Glaucoma is a gradual dying off of the optic nerve tissue, which connects the eye to the brain, so it's kind of plugs the eye in there. And it's not caused by anything that you do or don't do. It's mostly age-related, and there's a strong genetic factor too.
So what causes that optic nerve to die off? Or how do you make the diagnosis of glaucoma? What goes on there?
The problem with diagnosing glaucoma is that most people don't come in with any complaints about it. There's no symptoms in the early stages of it. And so they don't know that they have it. They could be coming in just for glasses and think that that's all they need. And when you check their eyes, you check the eye pressure as well as a full dilated exam. And when you're looking at the optic nerve, if the tissue looks thinner than average, especially if there's some asymmetry between the eyes, that's a red flag that you are in the beginning stages of glaucoma.
So how common is it? How often would you, or what's the risk to someone, say, over 50 or over 60?
Well, they estimate that, at least in the United States anyway, that there's probably 2.2 million people that have been diagnosed with it, and maybe another 2 million that don't know that they have it. And it is the #2 cause of irreversible blindness in the world.
So what, how do people not realize that they're going blind?
Well, because in the beginning stages, it does chip away at the edges of your vision, and you don't see what you don't see. You don't realize that you're losing that. And your central vision remains perfect. You can be 20/20 and only have 5 degrees of tunnel vision, and you don't really notice that happening until it gets pretty severe.
And you're saying there's no symptoms?
There's no redness, no pain, no blurred vision. There's not even a pressure sensation, even though eye pressure is related to the cause and even to the treatment of glaucoma, although people can have what's called low-tension glaucoma. But if you think of the eyeball like a grape, and it needs to be inflated and stay inflated in order to function properly, that average pressure should be between somewhere 10 and 22 millimeters of mercury. But if the pressure gradually goes up as you get older, and it does tend to gradually go up, then it puts some pressure on the optic nerve and on the blood supply to the optic nerve, so that it gets relatively starved of oxygen and nutrients as you get older. And if there's already a genetic susceptibility, then you're at even more of a risk of getting it.
Now, you've mentioned having your annual eye checks after you're 50. So which tests are going to be picking up glaucoma? You know, if you go to an optometrist, for example, instead of an ophthalmologist, perhaps, what do you need to know that they have done to know that you've got the test done?
Well, so everybody's usually familiar with the puff of air because they hate it and it startles them.
Yes.
That is a method of checking the eye pressure. There's other methods too, but you do need to know what the eye pressure is. Most commonly, glaucoma is caused by increased eye pressure, although, like I said, there's other cases where it can be a normal eye pressure. And then the pupil needs to be dilated, because you really need to have a good look at the optic nerve tissue in each eye, because that's the final standard. If the optic nerve tissue doesn't look healthy, if it's not healthy, then you have glaucoma, regardless of the eye pressure reading. But you really need to check both things.
So how do you treat it?
So once you know that you've got glaucoma, then it's very treatable. It's usually 1 drop a day is enough to drop the eye pressure. These studies show that if you can drop it at least 20 to 30% from the untreated pressure where you were getting damage, that it should be enough to halt the progression of the disease. Problem is, most of the time people don't know they have it, but 1 eye drop a day is enough to fix it. And if you can treat it early, you should never lose vision from it. But if you don't know that you've got it, you can't reverse the damage once it's occurred.
Okay.
You can only halt it.
Right. And so you say 1 drop a day should be enough, but that sounds like you actually need to track, as a physician, you're
Right.
tracking the changes in the optic nerve to tell whether you've actually won the battle?
That's right, because we think that that should be enough. But depending on the person's disease and how severe it is and how susceptible their nerve tissue is to that, we have to continue to check, usually every 4 to 6 months, to make sure that the nerve tissue isn't thinning out, even if we think the pressure is in a good range. And so we have multiple tests that we do to check for that.
And if you've already got tunnel vision, when you get that diagnosis, you will always have tunnel vision.
Right, I can't bring back what you've lost, and that's why it's so important to screen for things like glaucoma early, because if you can catch it early and prevent the vision loss, then you can save their eyes. But if they get to you already when it's in the end stages, although you can still try to stabilize it at that point, you can't bring back what they've lost.
Dr. Hertz, there are a lot of medications that on the box it says don't use if you have glaucoma. Tell us about that.
So what that's really talking about is the narrow angle kind of glaucoma. And to explain that, it's referring to either an open or a narrow or closed angle in the eye where the drain is. And the drain of the eye is right where the colored part meets up with the white part of the eye internally. And so if that angle that's formed when those two tissues meet is a narrow angle, then that puts you at risk for that type of glaucoma, which is actually very rare. So those cough medications or cold medications tend to have antihistamines in them. Could be dangerous for somebody with the narrow or the closed angle type, but the large majority of people have the open angle type, and those have no effect on people with the open angle type.
Okay. So are there different risk factors for the open angle or closed angle, narrow angle glaucoma? Or
That's a good question, because the narrow angle type is much more common in certain ethnicities and much more inherited as far as that goes. But the open angle type also has a more common finding in African Americans as well as Hispanic people. And for example, people that are 75 to 85 and African American or Hispanic, about 23% of them in the US have glaucoma, versus Caucasians who maybe 10% of them at that age have glaucoma.
So if you're an African American or Hispanic aged over 75, you have a 1 in 4 chance of having glaucoma. Often it's only found at a routine checkup, so be sure to have them. I'll see you after the break.